Welcome to Understanding Human Anatomy. This video will continue the discussion of the gluteal region, and you can see that I'm starting with the diagram that we ended with on the last video, except that I've removed the labels. So this is the piriformis muscle, the superior gluteal artery, vein, and nerve, the inferior gluteal artery, vein, and nerve. I want to sketch in now another muscle, and this is the Obturator internus muscle. And the Obturator internus muscle is another muscle that takes origin on the inner surface of the pelvic cavity. It originates from the obturator foramen, specifically the membrane that fills almost all of the obturator foramen, and from the bone surrounding the obturator foramen. This muscle then passes out of the pelvic cavity by passing through the lesser sciatic foramen, and it comes over to insert on the greater trochanter very near the insertion of piriformis. So let me fill in the obturator internus muscle. Then associated with the obturator internus muscle are two muscles that take origin from the os coxae, specifically from the ischium, and one takes origin from the area above obturator internus and the other takes origin from the area inferior to obturator internus. And these are the two gemelli muscles. The superior gemellus, which I'm coloring in right now, and then the inferior gemellus, filled in here. So we have superior gemellus, obturator internus, inferior gemellus. And they really function pretty much as one muscle, all coming over to insert on the greater trochanter of the femur. Now, the obturator internus, the two gemelli, and piriformis all are lateral rotators of the hip. Piriformis is a very weak abductor. So let me label these muscles. The obturator internus, the superior gemellus, and the inferior gemellus. Now, one last muscle I want to sketch in this immediate area is the Quadratus Femoris. The Quadratus Femoris takes origin from the ischium and passes directly over to insert on the lesser trochanter of the femur. So I'll sketch that in there and then color it in so it's more visible. The Quadratus Femoris. And the Quadratus Femoris is also a lateral rotator. And we'll draw a line to the label here. So, Quadratus Femoris. Now that I have these muscles, these lateral rotators sketched in, I'm going to sketch in the sciatic nerve. And the sciatic nerve enters the area through the greater sciatic foramen, passing inferior to piriformis. It then angles laterally before turning inferiorly. So it's really an S-shaped nerve, an S-shaped course through the gluteal region. And it's an extremely thick nerve, much thicker than any other nerve you've seen in a cadaver. And let me color it in. There. And the sciatic nerve is really two nerves that are bound together. It is the tibial nerve and the common fibular or common peroneal nerve. So let me just draw a line through the nerve like so to indicate that it's really two nerves in one. And these two nerves will separate in generally the upper thigh region. Sometimes it's down into the middle thigh, but usually the upper thigh. So this is the sciatic nerve. And again, the sciatic nerve is made up of the tibial nerve, and the common fibular or common peroneal nerves. So let me draw a line to the sciatic nerve. draw a line to the tibial component and to the common fibular or common peroneal component. So you can see that the sciatic nerve takes an S-shaped course through the gluteal region, and what I want you to remember is that when injections are given in the gluteal region, the needle is placed out in this area, and we'll see that'll be roughly the area of the gluteus medius muscle. And it does aim out here to avoid accidentally putting the needle into the sciatic nerve, which would be extremely painful for the patient. Now, next, we're going to sketch in the gluteal muscles. First, I'm going to sketch in the Gluteus Minimus, and it takes origin from the ilium and then passes down to insert on the greater trochanter. And as the name implies, this is the smallest of the gluteal muscles. So this is Gluteus Minimus. Then, overlying and completely covering Gluteus Minimus is Gluteus Medius, and it also takes origin from the ilium and inserts onto the greater trochanter of the femur. And let me color this muscle in. And you'll notice that as I color it in, we lose sight of the Gluteus Minimus muscle. So this is Gluteus Medius. And as the name implies, Gluteus Medius is the intermediate size gluteal muscle. Gluteus Medius and Gluteus Minimus are the primary abductors of the hip, and they are innervated by the superior gluteal nerve, and their vascular supply is via the superior gluteal artery, and blood is drained by the superior gluteal vein. And actually the artery, vein, and nerve pass between medius and minimus, innervating and supplying the medius from the deep surface and the minimus from the superficial surface of the muscle. Now, the last muscle in this region that we will talk about is the Gluteus Maximus muscle. And again, as the name implies, this is the largest of the gluteal muscles. It takes origin from the ilium, from the sacrum, and from fascia. And it covers over most of the Gluteus Medius muscle, and we'll color in the Gluteus Maximus. And this then is the Gluteus Maximus. Muscle. And it inserts primarily on the femur and on the iliotibial tract, which the tract I will show the beginnings of up here. And the iliotibial tract is a thick band of connective tissue running from the Gluteus Maximus down the lateral side of the thigh to attach to the tibia. There is the iliotibial tract. And the Gluteus Maximus is a very strong extensor of the hip. It is a relatively weak abductor. Now, the iliotibial tract extends superiorly along the edge of Gluteus Maximus, all the way up to the ilium. But what we're going to find is that the superior part of the tract separates into two layers, and filling the space between those layers is another muscle. It's a relatively thin muscle, and the name of this muscle is Tensor fascia lata. And I'm trying to color it in here. The tensor fascia lata. The tensor fascia lata is an abductor of the hip, but it's in a favorable position to help the body balance on the heads of the femur. Our torso does balance on those spherical heads of the femur, and this muscle actually spans anterior to posterior around the femur itself, so that it can be used to make fine corrections in balance to keep us upright on those femur heads. That concludes our discussion of the muscles of the gluteal region. Thank you for your attention.